All Trump budgets did not cut Social Security or Medicare. Democratic leaders like Kamala Harris misrepresent good government measures, primarily from Obama, as senior budget cuts. August 16, Vice President Kamala Harris speaks in Raleigh. The Democratic National Convention and election season will feature variations of these claims. This attack line shows that Donald Trump's commitment to not change Social Security and Medicare if re-elected, despite a financial crisis in the future decade. Trump is inconsistent on policy, so it's unclear if he'll honor his promise. The attack is misleading. In the 2018 to 2021 budgets, he proposed Medicare cuts to save money and extend the program's solvency, primarily borrowing from the Obama administration. Trump targeted very tiny Social Security disability program reductions in those budgets, not retirement benefit changes. The details. Depending on the president, both parties lie about Medicare cutbacks. In response to a president's budget, the opposing party's politicians claim that any difference over 10 years between anticipated Medicare spending, the baseline, and law changes intended to reduce spending are devastating cuts that will harm seniors who rely on the old age program. Politicians and reporters often discuss $350 billion in cuts without context. Medicare is so large, more than $10 trillion over 10 years, that percentage is small. The heated rhetoric ignores the fact that health professionals, not Medicare consumers, would reap most of these savings. Some hospitals and doctors resist fiercely, but these are good government measures to make Medicare more effective and cheaper. The dominance of hospital and medical lobbies makes such changes difficult. Obama took George W. Bush's budget proposals for squeezing providers. Trump added Obama's unfulfilled requests, such as charging the same office visit rate for doctors in hospitals and elsewhere, to his budgets. Trump struggled too. In any scenario, Congress may halt or limit provider cuts due to political pressure. Mark Goldwein, senior vice president of the Nonpartisan Committee for a Responsible Federal Budget, which tries to reduce the deficit, extensively examined Trump ideas each year. The underlying premise here is rather ridiculous, he remarked of the Harris-Walz message. Harris's tie-breaking vote for the Inflation Reduction Act decreased Medicare healthcare costs through inflation limitations, Goldwein said. You may say Joe Biden cut Medicare. In 2019, the budget group calculated that 85% of Trump's Medicare savings came from provider reductions, many of which closely reflect or build upon ideas made in President Obama's budgets and would lower elder costs. We predict that actions that lower healthcare costs and enhance Medicare's finances would account for another 5% of the savings. The majority of the savings came from Medicare's prescription drug plan design, which the group predicted will lower costs for some seniors, particularly generic medication users, and raise them for others. In 2020, the Center for Budget and Policy Priorities, a left-leaning budget policy research group, agreed, noting that the Medicare Payment Advisory Commission, a congressional agency, borrowed some of its ideas to address provider overpayments. Most of these suggestions would have cut provider payments without affecting beneficiaries. As a result, most are duplicates from previous years, said Paul N. Van de Water, a Medicare and Social Security senior fellow at the center, in an email.